2 standing exercises for straightening of the lumbar spine. In this video, I'm going to show you 2 standing exercises for the straightening of the lumbar spine. A straightened lumbar spine occurs when you lose the normal lordosis or curvature of the low back. Normal lordosis can start to flatten out, and it's also referred to as flat back syndrome. So this would be a normal lordosis. This would be a flattening of that. Straightening of the lumbar spine can be a source of severe and debilitating not only back but leg pain. It can also lead to premature aging of the disc bulges, degenerative disc disease, and it can lead to a host of chronic degenerative spinal problems and limit your ability to function in life. We need a curve or a lordosis in order to absorb shock. In our office, we provide specific non-surgical correction of a straightening of the lordosis of the spine. I'll talk more about this later in the video. Now I'm going to show you 2 standing exercises to help improve a straightened lumbar spine. You're going to find these exercises not only can help improve alignment, but start to help provide some relief from lower back and even leg pain. And the beauty of this, you don't need to do any or use any gym equipment. Now, the reason we start with standing is, number one, is that standing is easy. And anything that's easy increases compliance, and compliance leads to success. And some people just quite frankly have trouble lying on the ground. Now, make sure to watch to the end of the video because I'm going to outline our 3-step approach on how we specifically target the correction of a straightened lumbar spine. I'm Dr. Gregory Kramer. I'm a certified chiropractor in chiropractic biophysics. I practice here in Livonia, Michigan. I've been in practice since the 90s, and I've seen over 200,000 office visits, and every year I get a little bit better. Now, I specialize in helping people with chronic degenerative spinal conditions, typically problems that arise after a car crash, sports injury, or a hard day at work. Now, these problems in the spine usually lead to things like disc bulge, disc herniation, whiplash, leg pain, sciatica, and a host of other degenerative spinal conditions. There's 3 primary ways that we help improve the alignment of the spine, particularly the curvature of the lumbar spine. We use a method called chiropractic biophysics, and if you want to see some research about that, just go to idealspine.com and you can find a host of information. And if you go to CBP nonprofit, you will find tons of research for those of you that would like a little bit more detailed research. So the methods I use in my office are specific mirror image adjustment, mirror image traction, and mirror image or targeted spinal exercises. If you have any type of disc problem, whether it's a disc bulge, disc herniation, degenerative disc disease, we also include non-surgical spinal decompression. Now, before we go on, I would like you to hit the subscribe button if you want to learn how to relieve pain, stabilize your spine, avoid spinal surgery so you can live stronger longer. Now let's dive into these 2 standing exercises to improve straightening of the lumbar spine or flat back syndrome. These exercises are safe to do, but remember, if something hurts you, stop. No exercise should cause pain or pain radiating down the legs. Now, for the right person, these exercises are not only going to help reduce pain, improve mobility, but actually help leg pain. Again, these exercises should not hurt. All right, so let's start with the first one. So when someone has a loss of curvature, so we should have a curve to the low back. This is the lumbar spine. Lordosis is the term when we lose the curve, okay? So lordosis, there should be around a 30 to 40 degree curve. As we lose the curve, as we lose the normal lumbar lordosis, that's what we call a flat back syndrome. This would be flat. This is a normal lumbar curve. Flat, normal. We need the curve to absorb shock. So, generally, typically with people that are 50 and younger, when we lose the curve, that puts more pressure on the disc, and your ability to absorb shock becomes less. Okay, we need to be able to absorb shock in our everyday life. So a simple exercise, put your hands behind your back and just lean back. And it will help if you tighten your stomach and tighten your butt muscles. So tighten your stomach, tighten your butt, take your thumbs, put them in the small of your back, and lean back. Okay? Now, I would probably hold it 5-10 seconds. And if it hurts, we stop. If it feels good, if the pain in your leg starts to come up a little bit, like it reduces or it gets less intense, that's a good sign. I'd start with maybe 3 repetitions, 10-second hold. So 3 reps, 10 seconds. And then the next day, I'd probably add a few reps. I would add a few reps every day as long as it feels good. If it feels good, you can work your way up to 100 reps. So you could do 10 reps 10 times a day. Now remember, if it causes pain, we don't do this. If it causes low back pain, we don't do this. If it causes leg pain, we stop, okay? So that's the simplest exercise. Now there's a progression. So if just standing and putting your thumb feels good to you, well, let's show what you could do with a towel or a band, okay? So one of the things that you can do is you can have a strong band, like an exercise band, but I recommend a fat one, and that you put in the small of your back, and you hold, and that creates a little fulcrum while you lean back. So if we hold, it gives you something to bend around. Now, where do you place this? Well, if you were in my office, we would scientifically measure. We'd personalize it by taking an x-ray. But those of you in YouTube land, you know what? You could test really low on your back near your belt line, so right about here. Or you could bring it up around lumbars 2 and 3 here. So whatever feels the best. So you would take a nice fat band. You would put it in the small of your back. You'd put some tension, tighten your stomach, tighten your butt, and lean back. So this would be the small of my back. What if I want to test a little higher? Tension, and lean back. So I would do about 10-second holds. Again, if there's pain, stop. If there's pain going down your leg, you stop. And if the next day it makes you worse, we don't do it. However, it's a trial. So do a couple reps and gradually work up to 100 reps. So sometimes 10 reps 10 times a day. And again, we don't progress. So if the first exercise hurt you, certainly don't use this. Now, if this felt really good to you with a band, what you can do is you can actually attach this band with a door hook so you get a little bit more resistance, a little bit more of a fulcrum. And for some people, it's magic. That relieves the pain. That sucks that leg pain right out because it really helps reshape the spine. So this is a great exercise that you could do for the right people. Again, we always test, we personalize this. And whatever doctor you see, they should test you. You can be a little more scientific by measuring your x-rays, and you can actually take an x-ray while you do an exercise. Isn't that cool? So you can actually see what your spine does. Again, we're trying to relieve pain, improve mobility, improve the curvature of the lumbar lordosis, and to increase the curve of what we call flat back syndrome. Now, the other thing we would do in our office would be mirror image traction. We showed that on the other video, and I'll kind of demonstrate it again. Now you can see here, this is a picture. This is a potential patient sitting, and this is a dinero roll, all right? And this is designed to help improve the curve of the low back. So this person would lay down over this. Now this is prescribed, so you can't really do this on your own because it's not for everybody. And this is actually a fairly aggressive device to reshape the spine. So again, in our office, if someone has a reduced lumbar lordosis or flat back syndrome, we would do exercise, adjustments, traction, and then this is our home version of traction. And this home version, we'd start at 3 minutes and work up to 20, and it would look kind of like this. The spine would bend. It would help increase the curve. Now, sometimes we put a block under the head, sometimes we don't. There's lots of individual variations. And again, it's not one size fits all. And sometimes we would put this down low. Sometimes we bring it up high. Sometimes we would have it very low. So again, it depends on the individual. So again, this person, this would probably hit about L3. If we needed more curve down low by the belt line, we would reverse this so the peak of the dinero roll would be a little bit lower. So again, this is another way that we would help improve the lumbar lordosis. And the technique that I use is called chiropractic biophysics. Now, chiropractic biophysics start with a scientific assessment of the spine. We take x-rays from the front and from the side, and then we compare you to a normal spinal model. Just like if you went to a dentist, if your teeth are crooked, he's going to compare your teeth to a normal dental model. We do 3 things in the office. So once we found a patient has a misaligned spine or reduced lumbar lordosis or both, we would then prescribe very specific mirror image adjustments. That's what the doctor does. We would do mirror image reconstructive traction. We would do it in the office, and then when they're ready, they would do something at home. Again, the home care helps speed the results, saving time and money. And then the third thing we do is very specific targeted exercises. So at first, you got to measure the spine. You got to diagnose right. So diagnosis is first, and that's with a thorough x-ray, and then we do adjustments, exercise, and traction in the office, and at home, you're going to be doing some type of traction and some type of exercise. Now, if you're looking for a chiropractor that does chiropractic biophysics near you, which is the most scientific form of corrective care, let me know. You can always go to idealspine.com and you can search for a doctor in your area. And these doctors are in the United States, they're in Mexico, they're in Europe, they're all over the world. So again, go to idealspine.com. And if you need a little more help, you can always let me know in the messaging section if we can find a corrective chiropractor certified in chiropractic biophysics. Now, I hope you like these exercises, okay? These 2 standing exercises are simple to do. Now it's your turn. I want to hear from you. I showed you the exercises where you can lean back without a band. Does that feel better to you? I showed you with a band. Let me know if you felt better with one versus the other. Tell me which standing exercise you like the best, and also tell me about the band placement. And also tell me, did you hook up the band to a secured wall? Because that adds a little bit of intensity. Now, if you got value from this video, do me a favor. Please like it and share it to others in need so that we can help other people, particularly people that are suffering from a straightened lumbar spine or flat back syndrome. And please subscribe to my channel now if you want to learn more tips how to relieve pain, how to stabilize your spine, avoid spinal surgery so you can live stronger longer. Now, if you want to learn more about the 3-step approach, how we correct in my office in a non-surgical manner, go ahead and watch the video here.